Hello, my name is Debbie Boone, and I want to welcome you to my podcast, The Bend, where we explore how successful people navigated the path and emerged in a better place when life threw them an unexpected twist. It's inspired by one of my favorite sayings: the bend in the road is not the end of the road unless you fail to make the curve. These conversations will hopefully help you and inspire you to embrace your personal bend and to flourish. I hope you enjoy it, and if you need help with your own personal navigation and you're in veterinary medicine, please feel free to reach out to me at Debbie Boone to Manage Vets Consulting. Enjoy the bend and be inspired by our wonderful guest. Welcome. Hello, everyone, and welcome to today's episode of The Bend. I'm your host, Debbie Boone. And I am pleased to introduce you to Dr. Gershon Alaluf. He is a veterinarian, entrepreneur, doctoral candidate studying the real drivers of stress, burnout, and career disillusionment in veterinary medicine. So the reason I reached out to Gersh is he's been writing the coolest articles on LinkedIn, and I'm going, yes, 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 the whole time I'm reading them. So he has owned and operated hospitals for over 2 decades, and then he stepped away basically because he was seeing the same pressures that you guys are talking about, every single day in vet med. So now he's doing doctoral research at Pepperdine, and he is examining how psychological strain, emotional labor, and physiological stress responses are shaping the veterinary workforce. Now, I love all this stuff because I live in this communication space talking about limbic brain responses and the fear for human responses that we are working on in animal health. He also hosts a podcast called The Irreplaceable Truths. So it's making me feel a little nervous because he's a professional podcaster and I'm kind of winging it here and have been for 150 episodes. But his mission is pretty direct, is to challenge the profession to confront hard truths and build a more sustainable future for the people inside it. And I absolutely love that because it is the entire premise of The Bend is we have guests who are bending the profession for the better. So Gersh, thanks for coming on. And we've had a really good talk before we started recording, so I hope it continues on.
Oh, it will continue because Peter Weinstein would tell you I have so many opinions and so few filters. So, I want to thank you for having me. Obviously, I've really appreciated everything you have done for this profession. I obviously got to know you intimately through Veterinary Partners, which is a phenomenal organization for anyone who doesn't know what it is. It's basically people outside the clinic supporting the clinics. And it is it's a think tank actually of who's who.
Yeah, I agree with you. I agree with you. And I told you the story just briefly. So when I joined Vet Partners, you got to introduce yourself, and all I could think of was to thank all the people that were in that room because they were the people who had written the articles and given the continuing education presentations that guided my professional knowledge. And without them, I would have been lost, just absolutely lost in the weeds. So my comment was, thank you very much. My name is Debbie, and I appreciate all you've done. And I didn't tell me anything about what I did for a living. I just said thank you. So, anyway.
Hi, Debbie.
Hi,
Debbie.
And it worked out okay. That was 2011. I think people kind of know who I am by now, but that's all right. So I really love your backstory. So let's talk a little bit about how you ended up in veterinary practice in California, because you're an East Coast guy and, just found the right woman and ended up in California.
Yeah, finding the right woman, you mean basically someone who's put up with my crap for 30 years. Yes, I have. And I'm very blessed. And I hope everyone out there can find someone that will put up with your own personal crap for that long. And she thinks I'm crazy for doing what I'm doing now. But, this profession has been everything to my family, myself. Just like every other veterinarian, I had this love of animals since I was 3, 4, 5 years old. Always had the compassion and always wanted to be a caregiver. And, for me, it was a no-brainer. Even though in high school, I lost that track. I was a swimmer. I thought I was going to be a professional swimmer. Graduated high school with a 2.6, but I was a good swimmer. And it got me into 18 different universities.
Oh, wow. You were a really
So
good swimmer.
yeah, so
Yeah.
it really helped a lot that way. Um, I had big schools looking at me, and I couldn't leave the beach growing up in South Florida, so UNC Wilmington was the place to be, and it was the greatest decision I ever made in my life, besides marrying my wife. Because it led me down this path. Because as soon as I got there in 1990, I started immediately working at a veterinary clinic as a kennel boy. And, 5 years later, I was the practice manager. And while I was working there, the two owners, two gentlemen, they were my second and third dad, basically. One of them actually, when I got into vet school, loaded up the U-Haul and drove it out to Illinois for me from Wilmington.
Oh, wow.
And he was one of the groomsmen in my wedding, and till this day, he's still my mentor. That was very special. I think those two prepared me for being a veterinarian. There was no comparison to what they prepared me for versus what school prepared me
Hmm.
for. Obviously, school gives you a little more finesse on the clinical skills and deductive reasoning and stuff like that, how to work through stuff. But they taught me the soft skills. They taught me how to treat the staff, how to run a clinic, how to treat the clients, how to talk to clients, how to write things, even on a prescription. They're I was writing up a prescription for them that's like, give one tablet for pain. They're like, never use pain, say discomfort. Just little things like that, little tidbits here and there that just stuck with me. And when I got to school and compared myself to all the other one of my classmates, I would say there was probably five of us that were really prepared to go out
Yeah.
into the real world.
Yeah.
And
Yeah. In interviewing the hundreds of veterinarians I have interviewed over my career, I always love to see the ones that had really worked in practice because I don't think that school can prepare you for the real world. And sometimes I think we do students a disservice by not letting them know how much peopling there really is involved in the animal care. Because I think there's a shock there that says, oh, I think I'm going to go out and I'm going to save the world. And it's amazing now everybody wants to be a zoo animal vet, right? There's like four of those in the universe and everybody wants the job. But there's an unrealistic expectation, that I'm going to go out and be the hero of my story. And when we get out and the reality strikes us and we find that we're not the hero of the story, the client is the hero of the story, we are just the Obi-Wan Kenobi wise counselor to the client. It changes our perspective a little bit, but I feel like we younger veterinarians suffer unnecessarily because we don't teach them what it's really going to be like when you get out into the world.
you're touching on parts of my dissertation, and
No.
I'm just going to give you a little heads up. You're the first person that's going to hear any of my uh, preliminary data too.
Oh, I'm so
So
excited about this,
So
guys.
yeah, so it's going to be good. But no, I mean, you hit the nail on the head there. I mean, can you believe there's vet schools that accept students that have zero experience?
I do. I'm shocked at it. But
And
the
they're
other part,
not
yeah,
or even a job. Forget veterinary,
yeah,
just a
right.
job in
A job
general.
at all. They don't know how to have a job. And the other thing that shocked me, and so Jim Lloyd's a friend of mine, and we were having a drink at a bar. Imagine that. And it was a vet partners meeting. And I was saying, like, we were having this discussion, and he said, Deb, when I went to vet school, all of the professors that worked there had worked in the real world of veterinary medicine, out in the universe, into practices. Today, none of them have. They stay in academia and they never leave that world. And that is not reality. That is by its definition. I laughed and I was telling Jan Bellows one day, he was talking about staging dentals. I said, but Jan, people are coming to you because you're a specialist. So they already are kind of self limiting, the fact that they are
Mhm.
willing to do that and willing to pay. I said, I
Right.
work in Reidsville, North Carolina, and half my clients don't even have teeth. So you're telling me that, I'm going to stage a dental in my practice. I don't think that's
Uh,
going to happen, right?
Well,
Um, yeah,
well, the thing is, veterinary schools are tertiary care centers, right?
yeah,
And so people are already going to the school knowing they need an MRI, knowing they need
yeah,
an ultrasound, know they
yeah,
need a brain surgery, knowing they need something that a general
Yeah.
practitioner
Big medicine.
won't be doing.
Hmm.
And you're absolutely correct, because that is a flipping nightmare when it comes to these students, because they think, oh, the owners are just going to come in and listen to everything they
Yeah.
say and they're just going to do it.
Yeah.
And I agree with you. I don't get me wrong. These professors are brilliant.
Yeah.
They are brilliant, but they haven't walked the front line.
Hmm.
And my comparison I always make is like, say you're in the military. Would you want a general that's never been in battle?
Mm-mm.
Would you, right?
Mm-mm.
Like, you need people from the front lines doing this.
Yeah.
And that that is one of the big disruptions I think that needs to be made, because you're absolutely correct. A lot of these academians, yeah, they went and did a residency somewhere, usually it's university, very, because they wanted to start doing research during their residence. And like I said, they're brilliant. The things they come up with are brilliant. But that's also why Dr. Danny Rabwin and I, and it was Dr. Danny's brainchild. She's starting. She wants, and we've done two so far, which is basically CE for GPs taught by GPs,
Ah, yeah. Yeah.
right?
Hmm.
Because we know, like, we understand the cost of care
Hmm.
and
Hmm.
all those things, and those are things that you don't get taught in school.
Right.
It's like,
Yeah.
yeah, the dog needs a dental. Okay, let's go do the teeth. No
Hmm.
problem. School, you do it. Yeah, exactly. Like you said, doing a dentistry in practice, and no pun intended, is like pulling teeth.
Yeah.
It's it is so hard. There is communication. You need to educate. You need to make them realize the return on investment, and the return on investment is a healthier animal,
Mhm.
an animal that doesn't have discomfort, an animal that's eating better, an animal that just feels better, an animal that you can keep on your lap because their breath doesn't smell like a.
That's right. Exactly right. Tucker just had his $650 dental and four teeth extracted, and he's a 4-year-old Bichon, and I brush his teeth every
You
day.
must have gotten a discount if it was
I think I
650.
did.
Yeah,
I think I
I was
did.
gonna say.
Honestly, I have that little
Yeah,
professional courtesy
yeah,
discount. Thank you very much to
yeah.
Dr. McDaniel. But yeah, I think you're exactly right. And and there's so much education. And I always laugh when somebody asked me one day if I could teach them how to teach reception skills, and so the sales reps for Elanco could go out and do that. I went, no, you have no credibility whatsoever in the world, but I can teach you how to teach them great client service because you're trained on that, and sales skills. And I said, but you can't tell them that you're teaching them sales skills, because they will faint and have a heart attack. But the truth of the matter is, unless we are really good salespeople in our profession, our patients don't get care, because salespeople shine light on needs that you have that you don't even know about, right? So they're presenting to you an unspoken need and saying, I have a solution to your problem. And we are so medically minded that we are just thinking about, oh my gosh, this dog, he's going to have, all this circulating bacteria, and it's going to do heart, liver damage. Instead, we're going, do you want this dog whose mouth is filled with pus to lick you in the face? Because he's going to. And so
It's an
we
art
can,
form.
yeah,
It's an
we can solve
absolute
that.
art form.
I can solve that. So we now have to understand, the idea that that old adage, right? That when clients come in, or when people buy a drill, they don't want a drill. They want a hole, and they want an easy hole, right? So they're buying a drill. And we are selling problem solutions, and not, just this medical stuff. We try to teach people to be veterinarians, and they really don't want to be. But you were talking about veterinary school, and I said, one of the things that Banfield does that I appreciate is they do that top 10 list every year of the things that they see in all their practices. And it's the top 10 things they see dogs, and the top 10 things they see for cats. And it's that what they need to do is take that to vet school and say, teach this, because it's 80% of your practice every
Well, no,
dang day.
90% of your practice every day is derm, dental, and diarrhea.
Yeah. Yeah.
General practice, those are the three.
Uh-huh.
And, and truth be told, I do work at Banfield's as relief on the weekends. It's the best fourth quarter job I could ever have. I don't think Banfield is a model that any student should go into leaving veterinary school.
Hmm.
You're very limited in what you do. Like I bring my knowledge in there and I'm able to sit down and talk to a client and go over the disease processes that the animal's going through and why they shouldn't vaccinate and why that dentistry is important and why we need a blood pressure and why we need this and why we need that. And those are things that Banfield clients are not used to hearing.
Hmm.
And what I tell my wife is like, what I've learned is if I give these clients from Banfield 60% effort, they are over the moon ecstatic.
Hmm.
And so I love the Banfield model of the pay monthly type
Hmm.
thing
Hmm.
because if animals are sick, oh, you still have a blood panel available. You have chest films available.
Hmm.
You have this available. So the cost of care is not really the number one topic. It's
Hmm.
still a topic, but it's not the
Hmm.
number one topic.
Right.
And it's easier to get those dentals done. And they do these dentals when the teeth aren't
Yeah.
falling out. They're keeping
Yes.
them clean. But there are also issues as well because they're like vaccinating like these technicians want to give six vaccines on one visit and I'm like, what are you trying to do to the immune system here?
Yeah.
And if I go talk to the clients, I'm like, listen, I really don't like to give another injectable with rabies. I'll do a oral bordetella, no
Hmm.
problem. I have no problem giving distemper parvo and lepto together because lepto's gotten a lot safer
Hmm.
than it
Yeah. It used to
used
be
to
pretty
be.
hot.
Whoa,
Used
it
to
was
be pretty
gnarly.
hot. Yeah.
Yeah, it was gnarly. But I'm like, if I give all these vaccines right now, your dog's immune system is going to go insane. And I am going to cause a whole bunch of immune complexes to go settle in the kidneys. And then all of a sudden, you're going to come back in 4 years wondering why your dog is leaking protein in the urine, the blood pressure's through the roof, and the kidney values are on the way
Hmm.
up. And I say that to them, they're like, okay, no problem. We'll come back in 3, 4 weeks for the next
Yeah.
vaccine. Perfect.
Yeah.
But all I did was communicate with the clients.
Hmm.
And I, I don't think, and like I said, fourth fourth quarter, Banfield's amazing. First quarter, second quarter, I don't think that type of model is really beneficial for veterinarians to really learn
Hmm.
the art we were talking about.
Yeah, yeah. You brought up something that really has always kind of fascinated and kind of triggered me is that all in one, all
Mm.
one time visit thing. And over the years, I have had veterinarians in my classes, and when I said, look, if we're trying to be creative and help people pay, why can't we bring them back every other Friday when they get a paycheck to get a vaccine, a heartworm test, a fecal? We have to do it all at one time, and then these poor people have a $500 bill and they're freaking out and they think we're so expensive. But if we could parse it out a little bit, well, this old veterinarian's in the back and goes, I can't get them in there one time a year. Well, I'm teaching a client service class, and I said, you know why? You make it hell to come, right? You make them wait. You don't talk to them, you talk over their head. And so it's a bad experience for people, and so they don't want to come back. But if you make it a great experience for people, they'll come back as many times as you encourage them to come back and they believe and trust in you. They will come back.
Oh, Debbie, let me tell you, I put coffee bars in both practices I owned. I have clients that just would come in without their pet to talk to the staff, see how everyone was doing, grab a cup of coffee. And I mean, you and I both know 10% of your clients give you 90% of your
Yeah.
business.
Hmm.
But it's like that 10%, that's your sweet spot.
Oh,
That's who
yeah.
you really need to cater to. And that that is an art form that is not really taught to these
Hmm.
new career
Yeah.
grads. But I mean, it was amazing. Like if you create that family atmosphere, if you make it a safe space for their pet. I don't like fear free. I like
Hmm.
safe space
Hmm.
because I mean, the problem I have with fear free is if I don't re up my membership in a year when it's due, does that make me fearful?
Hmm.
So like a safe,
Yeah.
you know what I mean?
Yeah.
So like a safe space for their animal where they enjoy coming in. Like
Yeah.
if a client sees an animal walking back with his tail wagging and happy to be there,
Yeah.
they that alone, the amount of trust you gain just off of
Yeah.
that, having any conversation about illnesses or blood panels or anything that needs to be
Mhm.
done, so much easier.
Yeah, yeah. We had
And
a dog named Stewart who used to put himself away. He came every morning. We would just open the door in the front office and he would haul butt down the hall, say hello to everybody in the offices, come back up to the front desk, and then turn around and go back into the kennels. And he was the longest dachshund I've ever seen in my life, and we absolutely adored him. And he stayed with us every single day while his folks were the choir directors at the church down the street.
yeah,
But you're right. I mean, we should do that for the humans too. That
right.
is the other part of the equation is the making people feel really comfortable to come in and feel like you know them and that you care about them. And, I tell a story that sometimes my clients would come in and tell my CSRs like personal things that were happening in their lives because they knew that they would have comfort there,
It's like
that
a
they knew they
bartender.
would have understanding. Yeah. Sometimes a lot more than you wanted to know.
Yeah,
Absolutely.
you become a bartender at that
You
point,
you
right?
do. You do. And so they
But
make great
but
CSRs. Bartenders make great CSRs.
and the other thing too is like even little things too, like when there, obviously we have wildfires in California, and I
Mm-hmm.
wasn't I wasn't practicing when Malibu happened,
Mm.
that awful one. But we had horrible ones in the mountains that are just near where we are. We had, just all around.
Mm-hmm.
And every time a horrible wildfire would go up, we'd put it on social media. We would let everyone know if you were evacuated or anything, we will board your animal at no charge.
Mm-hmm.
The only thing we ask is that they're vaccinated and we will board them at no
Mm-hmm.
charge. And people would think, why aren't you charging them? And I'm
Yeah.
like, because I'm a human.
Part of the
These
community. Mm-hmm.
these people are trying to figure out where the heck they're going to go live.
Mm-hmm.
How many places do they get to choose when they have an animal?
Mm-hmm. Yeah.
Like, I'm just trying to make their life easier. And the amount of great publicity I would get just from being a human
Mm-hmm.
was priceless.
I used to tell a story in class that our hospital boarded close to 100 animals. And from Memorial Day until Labor Day, it was full every day, all day long. And then we used to give a party at the Labor Day, and like we made it through summer party for the
Right.
staff. But, we had over 4,000 active clients in 100 spaces. So obviously the math did not work. So we had kennels that we were comfortable with referring to. And people looked at me and go, well, why would you refer somebody to like your competitor? And I went, my duty working in a veterinary hospital is to care for animals, not just when it makes me money, but all the time, and to care for my clients. And if all it takes is referring them to a really great boarding kennel where they can get in and go over Christmas, then that's what I'm going to do. I'm also going to tell them no way in hell should you go over to this one because these people are crazy. They medicate people with animals with other people's medicine. And I've seen, ulcers and all kinds of stuff come out of that kennel. So you don't want to go there. So I'm looking after my clients and I'm looking after my patients all the time, not just when it's profitable. So, yeah. So let's talk about this challenge of the status quo. How you are working on this information and this data and challenging what we've always been doing in vet med to help us get where we need to be. Big
Wow.
question, Garb.
Yeah, big question. Well, no, I've always been a disruptor from when I was a kid. I always challenged status quo, but that's a big, if you look at, organizational management type research, Gen Xers are disruptors. Like we started questioning status quo. If you look at the boomers, like they don't ever question their doctor, they don't ever question their CPA, they don't ever question professionals. They just truly trust them. Our generation of Gen Xers, we started challenging status quo. Like, why? Why should we do that? What's the point of that? What are you sure what you're saying is true? So that has always been in my blood. Um, and it was while I was working in 2021, the article came out on the economic burden of burnout in veterinary medicine. And I think that number that they came up with in that paper was $2 to $4 billion. it just got me thinking, and at this point, I was only using the left side of my brain. I was a veterinarian, just doing numbers and cases and all that stuff. But I was like, these articles have been great. They're amazing research pieces. But why is the problem getting worse? Why is the problem gone from burnout to compassion fatigue and now the phenomenon of suicide in the profession? And I'm like, everything is slowly, it's not getting better. It's not getting better. It's getting worse. And by that time I was selling my practice and, finishing my MBA. And so the dean of Pepperdine asked me, "Hey, we've never had a veterinarian go through this program. Would you be interested?" And I'm like, "Absolutely." Um, and that's kind of, at first, before we came on, we are talking about, I was going to look at private versus corporately owned veterinary practices. And I didn't know who that was going to help or what that was going to do. But then I decided, okay, let's look at this burnout phenomenon. I was like, wow, if we say the word burnout, I think we're behind the eight ball because they're already burnt out because there's not that much research there. No one can give you an exact number, but once someone says they're burnout and they leave, how many of them successfully come back? That data doesn't exist. And I'm
Hmm.
like, that might be a little too late. So I want to look at the stress of the veterinary profession. And my bread and butter is early career veterinarian. I've been a mentor for my entire career. I had 20 veterinary assistants that I mentored and got into veterinary school. I can't tell you how many veterinary assistants I've helped uh, obtain their license. A matter of fact, two of the ones that I train now own a veterinary assistants licensing school here in Orange County.
That's very cool.
Um, so I've always been that, like, I don't parental coach. Here's my network, like I'm always available for you 24/7. I've always been that type of mentor because there's 9 stages to being a good mentor, not just being there when you were available type
Hmm.
thing. So I was going to look at early career veterinarians, and the problem is getting veterinarians to fill out surveys is next to impossible. And looking at early career veterinarians, they're already busy enough. Man, I had my surveys out for about 9 months. And I think I got 16, 18 responses. That's it.
Mm.
And I was invited to talk at the international DBA program that was held at Pepperdine in September. And it's amazing to me how many researchers are interested in the veterinary profession once you start bringing it to their attention, what's going on. The dean from Penn State sat me down and he said, "Listen, let's simplify your model. Let's open this all up to all veterinarians." I said, "Okay." And he said, and he goes, what you were going to use as controls, why don't you look at those?" So basically, my model for my dissertation was looking at resilience, was looking at psychological safety, was looking at psychological distress, and looking at how that causes stress. I looked at stress 3 ways. I looked at it via survey, via interview, and still waiting. Cause so I said, you're going to get some of my tidbits. I'm still waiting on the cortisol results to come back. And then to the one thing I was doing, what we call a dimmer switch, is emotional labor. So dealing with clients. So that is what I did. And what I have found, I don't want to say crazy, but it's really shedding a light on why I personally think this burnout is not working. Because if something isn't working right in someone's profession, what do we say? They're burnout, right?
Hmm.
If someone's not happy, oh, they're burnout. If someone's distressed, oh, they're just burnout.
Yeah.
They're
It's just
just
an easy
emotional.
bucket
Yeah,
for us
yeah,
to throw
yeah,
stuff in.
right. So burnout now has become this kitchen drawer. And everyone has it,
The
right?
junk
The
drawer.
kitchen,
Man,
yeah,
it's
the
the
jug
junk
drawer,
drawer.
right? Yeah,
Yeah.
just put it in there. And if you talk to veterinarians, a lot of them do not resonate with compassion fatigue.
Hmm.
I don't know many veterinarians that really fit that model. Now, I understand how nurses do, because if you compare nurses and MDs, like MDs in the hospital, if you're lucky, maybe you see them 5, 7 minutes in a day,
Maybe. Yeah.
but those nurses are there around the clock. They're 12
Mhm.
hour shifts. They get to know the patient, the patient's family, the patient's friends. All the other doctors are involved in the case. They explain the medical's decisions. They're almost the patient advocate. Um, so it's a little different. I mean, yeah, you could say veterinarians are that way, but you talk to people who are nurses, they never say, I wanted to be a nurse since I was 5.
Yeah.
I
Yeah,
wanted to be
you're
a
right.
nurse since I was 10.
Mm-hmm. Mm-hmm.
Usually when people become nurses, that is something that they usually figure out junior, senior year of high school, but
Mm-hmm.
usually it's in college, right?
Mm-hmm.
They're like, okay, where can I get a job? Oh, I kind of like medicine. I like science. Oh, there are a lot of nursing positions. They pay
Yep.
well. Um,
It's good. Yep.
yep, pays good. That's what usually want to do.
I would tell you, I was really shocked that nurses, it was only a 2-year degree to start. I was kind of surprised at that. I mean, obviously, I have nurse practitioners that work with me and they have master's levels educations, but I guess I was always thought it was a 4-year degree to be a registered nurse.
Well, to be a registered nurse, you're correct. It's only 2, but to get hired with only a 2-year degree is very hard. Even
Mm.
though, at least here in Southern California,
Ah,
even though there is a shortage, they're looking for the 4 years.
yeah.
So, yeah, exactly. But it's a little different, and it is a little different, So as far as status quo, I I'm I went into this whole challenging of the status quo by going in and saying, okay, let me see if I can find something a little different that will challenge how we're doing things. And I believe I have.
Debbie Boone here. I want to take a quick break and thank you for listening to The Bend. As many of you know, I am a trainer, speaker, writer, and consultant working to make life better for the folks in the veterinary profession. If you're a practice owner or manager, you've felt it. Team burnout, difficult client conversations, and the constant pressure to do more with less. That's why I wrote Hospitality in Healthcare, the culmination of my 40 years of peopling in vet med. It gives you a clear, practical way to elevate the client experience while making work feel better for your team, not harder. If you're ready to lead a practice that feels as good as it performs, you can find the book wherever books are sold. Now, let's get back to my guest on The Bend. So what is the idea? I mean, I don't want to blow your, dissertation out of the water here,
No.
but in reading the stuff that you've read, a lot of it has to do with this, I guess this moral dilemma that we run into all the time that says, I can fix it, but they don't have any money, or they don't want me to fix it, even though they have the money. And I've been in both of those positions with clients, having discussions with them. And then, putting down healthy animals. I mean, I always think about particularly like with the avian flu, how the veterinarians who are in charge of 50,000 deaths of poultry in one fell swoop, how they must feel that, they've tried to keep this flock healthy and then all of a sudden you have to wipe out 50,000 chickens, 50,000 birds, or actually more like 5 million, I guess, is the
Right.
truth of the matter. So, and the same thing for, different, like different diseases that are out there in agriculture. Um, it's a really tough moral dilemma that we get into because like you said, the point is, we wanted to help animals. We got out here to help animals and not to do mass destruction of them.
Well, the one thing, so here we go. I'm going to start little tidbits that are coming up. The one thing that my surveys, so the quantifiable, like measuring, least likely to most likely
Hmm.
scales, most of the stress that's coming out in veterinary medicine is from internal psychological strain. And dealing with emotions or emotional labor, it was the emotional labor in the profession, at least in my data set, was so high. I was able to take this scale to emotional labor medicine, emotional labor clients. And emotional labor medicine didn't move the needle at all.
Hmm.
Emotional labor clients, boom,
Hmm.
exponentially, it did.
Hmm.
So, so that quant data kind of told me that, okay, there's something internally going on. Um, Resiliency didn't do anything. Psychological safety didn't do anything. So, in my opinion, those two basically, when it comes to stress, they really, and I know Peter Weinstein's going to be upset because he's on my dissertation committee, but it really didn't do anything because when you have psychological safety and, what people call AKA culture of the practice,
Hmm.
or, resiliency, it the emotional labor wipes it out. It doesn't matter. It
Hmm.
doesn't matter how resilient you are, how
Hmm.
safe you feel about bringing up problems.
Hmm.
So, and I was like, oh man, you know what? Big deal. This is not bad. So then I interviewed 18, and I'm doing a mixed method study. So I'm mixing quant and qual and also physiologic. So this is a really in-depth study. Um, and the interviews really brought up a lot of stuff. And the one thing, remember how I said I was always using the left side of my brain.
Hmm.
Now I'm using the right side a lot. And that once you start using the right side of your brain, it never shuts off.
Uh-huh.
Never shuts off. Like all the gummies, all the California sober medication, there is it doesn't even turn it off. So I was walking my dogs one morning, and and the other thing you learn as you go through this MBA and the DBA, Doctorate in Business Administration process, is you learn when your best time to do your deep thinking is, and it's always early morning for me. I'm walking my dogs, and I'm like, this isn't making sense. What am I missing here? What am I missing here? And then that day I had Phil Richmond on a podcast,
Hmm.
and he brought up the whole concept of moral injury. And he said he talked to Wendy Dean. So, me being who I am, I went down this rabbit hole immediately when we stopped the cameras and I started researching moral injury. And I'm like, holy schmoly, this is this is what we're talking about.
Hmm.
And this is before I've gotten any data back or anything. I immediately got Wendy Dean's book, If I Betray These Words, read that book, and then I've had a few conversations with Wendy Dean since then. I had her on a podcast. And basically, the concept of moral injury is knowing how to do the right thing, but you can't.
Hmm.
And there's three main reasons why. Number one is management is looking at the wrong KPIs.
Hmm.
They're more interested in your average client transaction, how many clients a day you're seeing, you know, how much money you're bringing in. They don't care about, hey, this person gave you a 5-star review.
Hmm.
You should see this email this client wrote. The client loves you. They trust you. They love the clinic. They trust the clinic. They're looking at the wrong things.
Hmm.
Number two is we expect you to see all these clients and all these patients with less staff. So basically, you have to do more with less. So you get less time with the clients, less time with the patients. You're on a demand to hit some quota. And then number three is obviously the cost of care.
Hmm.
And this is where Wendy Dean and I butt heads because she's like 40% of human patients don't have health insurance. I'm like, Wendy, 93% of our patients don't have pet insurance. Every single appointment we see deals with the cost of care.
Hmm.
And last but not least, every single patient you see, euthanasia is a form of treatment.
Hmm.
And so we went back and forth on that.
Yeah. Well, and
So,
to say that people don't have insurance, you also have to understand that they could go to the emergency clinic and cannot be denied care because even if they don't have insurance, because there are government safeguards, and we don't
but they
have
still,
that.
but in her defense, it will bankrupt them
Yeah,
because
yeah,
they will go after them for payment.
yeah.
They will take them to court. They
Hmm.
will try to get it. You're absolutely right. They
Hmm.
will get treated, but that bill's still coming.
Yeah, but they
That
won't put
bill
them
is
to sleep
still
because of
coming.
it. Yeah.
Yeah, exactly.
Hmm.
So, so basically what I did with that is I started looking at moral injury in the veterinary profession. There's some qualitative studies out there. There is one quantitative study, but I was like, we need a better scale. So right now I'm just finishing up. I've created the veterinary moral injury scale, and it's only 10 questions. But basically it's looking at euthanasia, cost of care, and what is expected, the demands put on a veterinarian in practice. So that's the first thing it's going to do.
Hmm.
The second thing, my um, dissertation came up with is this whole concept of career identity disillusionment. It is not a theory out there. It is not anything anyone's really talked about, but it goes off the fact that I use the attraction, selection, and attrition theory, which is you attract, you select, and then people leave, right? People come in, we attract the same people every time, right? People who've wanted to be veterinarians since they were 8.
Mm-hmm.
We select the same type of people, which is the first filter is what?
Great.
GPA.
Grades. Mm-hmm.
And then they have the choice of 4 options. They stay within the profession and miserable. They pivot, so they either go relief or part-time. They leave or they commit self-harm. Those are your 4 options.
Mm-hmm.
Once you're in this spiral. And I can send you I in my dissertation you're going to see this outer circle, and it's a continuous circle. And the funny thing is that as people are trying to decide between their 4 options, guess what? The next class of veterinarians just got accepted and they're
Mm-hmm.
going in it again, right?
Mm-hmm.
And there's
Yeah.
still a whole bunch of 8-year-olds that are out there saying they want to be
Yeah.
veterinarians. And we keep doing this circle of insanity.
Yeah.
And there is no disruption in there. And there's no way to stop it. And all of them are going into the profession. And then once they're in the profession, you have moral injury, you have career identity disillusionment, you have emotional rumination where they go home and they just can't fall asleep because
Mm-hmm.
they're going over their head whether or not that client was pissed off, what management has done, how they had to practice that day, you name it.
Mm-hmm.
And then then those people have to decide what are my 4 options.
Mm-hmm.
So I continued thinking. I'm like, okay, no one's looked at stress like this. No one's talked about this. So, career identity disillusionment is one of my conceptual papers that I'm going to be writing and
Mm-hmm.
hopefully getting published. And it basically deals with okay, you create this identity when you're 8 years old, and that's all you do, right?
Mm-hmm.
You have a personal identity, you get it, you also have a person job fit identity. Like, I think I'm going to be a great veterinarian. Um, and that's all you've known. You've built your own self identity that way.
Mm-hmm.
And then all of a sudden you have all these stressors put on you, whether it be emotional, financial, from the clients, you name it. You have all these stressors. And then all of a sudden they start thinking, I got to get out of this. This is not what I signed up for. And that's where you get in the sunk cost theory.
Mm-hmm.
How much time, effort, sacrifices you have made, and debt
And
you've
debt. Oh
to
yeah, the debt. Yeah.
become a veterinarian.
Mm-hmm.
And that's the whole concept of CID. That's a whole different way of looking at what we call burnout.
Mm-hmm.
It's like we need to get in there and figure out how are we going to fix. And there's 4 different sections inside of that. So that was the next thing I looked at. And now the last thing I'm looking at obviously is cortisol levels. And chronic cortisol levels are called allostatic load. Chronic cortisol levels or having allostatic load in your system causes brain changes. And
Mm-hmm.
it causes chronic cortisol causes brain changes in your hippocampus, in your frontal cortex, in your gray and white matter. So again, walking the dogs, I'm thinking a light bulb goes off. And there's actually an email I got from Paul Pion that was asking me a question because he wanted to kind of know where my data was going. So I get home and I immediately research autopsies done on people that have committed suicide. Were there main changes in the brain? Now there's changes everywhere,
Mm-hmm.
but there are changes in the hippocampus and the frontal cortex in the gray and white matter. So are we looking at suicide in the profession wrong?
Yeah,
And if
it's the
so,
constant stress of cortisol level spikes. It's very similar to battered women syndrome, right?
correct,
Because you're constantly waiting for the shoe to fall,
correct.
whether this one's going to like hit you in the face or this one's going to be great. And I feel like we often live in an environment like that. Um, and sometimes we, especially in it, of course, I managed for 23 years, and allowing clients to continue to do that is the other part of the nail in the coffin, so to speak, is because we're so afraid we're going to lose a client in the business part of losing a client, or they're going to write something nasty about us on a review, God help us, that we don't have 5 stars on everything, is that um, we're constantly under that state of stress and we won't get rid of people who we need to get rid of. My theory was let them set them free to go and torment other people and leave my people alone. And
Right.
the same thing for bad staff. That's the other thing. The mean girl staff is let them go, no matter how talented they are and how bad it hurts. You can get rid of that one and change the atmosphere of your hospital and make people actually enjoy coming back into the building again.
Quick to
If we don't
hire,
let them go.
right. Quick to hire, slow to fire, right?
Uh-huh. Uh-huh.
That is a problem that we have in our profession
Yep.
because we're people pleasers.
Right.
And then obviously people are also bringing up the whole concept of, ACEs, which is childhood trauma.
Uh-huh.
And it would be very interesting to know how many veterinarians have a high ACEs score.
And technicians, I would say technicians are higher because I have, just from 40 years of perspective, looked back on this thing. I started in 1985 as a part-time receptionist, and I've been working with hospitals ever since. Is that we tend to attract slightly bent and broken people. And I really feel like that we're drawn to animals many times because they're such a safety net for us in childhood where we're not judged or not. There is unconditional love. No matter what's happening in the world around us, we always have the animals. And that because of that, we're drawn to serve them in our, adult profession. Um, I was fortunate. I had a great childhood growing up and great parents. I was just a science nerd. I just love the science of it, but animals too. But there are people who are, much more hard on their sleeve than me. And
Hmm.
going back to something else that you said is like the circle, like the same people keep coming into the profession and we're not really telling them what the truth of it is that
Right.
you got to be a little crusty. You got to be able to go F you and go home at night and sleep and not worry about what everybody thinks about you all the time because you're not perfect and you will never be
Well,
perfect.
that's the problem. That's the
Yeah.
problem, though. We select perfectionists
Yes, yes, it's the high grade, the overachievers. And one of the things that I love
with
that
zero social skills.
yes, that Nicole Bruno is doing is that encouraging a diverse group of young people who come from different socioeconomic levels to think that they can become veterinarians and to get into the profession because I think it will do such a world of good for that cycle that you're talking about is we're
Not if they don't get
feeding.
accepted.
Yeah,
Not if they
well,
don't get accepted.
yeah,
And that's the first level of disruption.
yeah.
That, right.
You got to
So
look at who your entry level is. What kind of challenges have they overcome in their life? Can they take it, right? Because, as a little kid, I grew up in the restaurant business. Feeding hangry people was a real thing for me from the time I was 12 years old. So when people were a little disruptive, it rolled off my back because I'd been doing it since the get-go and learned how to deal with it. And it didn't bother me because I knew that there was 500 other ones who were standing in line to get in the door and that this one was
yeah.
just probably wanting a free meal. So I feel like we are choosing wrong. And if you look at the class is young white women. I mean, that's all we have. And I'm an old white lady, but honestly, young white women. And many of them, we talk about student loan debt, but then when you look at the data, there are a great deal of them who have no student debt whatsoever because their parents were well off and they could afford to get them and pay for their education. So are we not choosing well, or
Right.
and because we're not choosing well, we are harming our profession and harming people.
What's the definition of insanity? Keep
Keep
doing the same thing
doing
over
the
and over
same
again and
thing.
expecting a different outcome,
Yeah.
right?
Yeah.
So, I mean, exactly. So your levels of disruption are for acceptance. Maybe emotional intelligence score might be the
Mm,
first level over
yeah.
IQ. Look truly at how many hours they have and what their job description was. Look at those letters of recommendation first. That should be your first filter.
Hmm. Ask better
That should be
questions
at your
on the
first filter.
interview, Gersh. I mean, that's the other thing
They
is
don't even interview. There are schools that do not
I
interview.
know. And I don't realize that they did it because there is a reason that they are afraid that they will put personal bias in there. But the missed opportunity to figure out if people could have a conversation with the client and to how they think, asking those good behavioral questions like how do you act in these situations? Tell me about the worst client you ever encountered and how did that turn out? What did you do? What did you This is the question I ask young veterinarians when I am interviewing them.
I had that question at Illinois.
Yeah,
I had that totally had that question. They said it's 6 o'clock. A client just came in, 6 o'clock at night. A client just came in. It was hit by a car. And I told them, I was like, because I had the true work experience, I had the true mentors. I knew. I'm like, I ordered pizza. I tell the staff we're staying a little later, and we're not going to keep the dog overnight because we're not in
right.
an emergency
We're
clinic.
going to stabilize and
Stabilize it.
transfer. Yep.
I, during COVID, I told my staff up front, if I hear anyone turning away a client, that is a fireable offense. I made it very clear. I put it, I even put it in our little handbook too.
Uh-huh.
So, because there are so many veterinarians that were turning away sick animals.
Yeah. Yeah.
And I mean, the emergency clinics out here in California had a 6 to 8 hour wait.
Yeah.
I'm like, what are we doing? I mean, COVID was panic medicine through and through from the human to the veterinary side. It
Mhm.
was just, to me, it was it was just absolutely poorly run. It was more like a private equity run clinic than it was a truly small business clinic.
Yeah. Yeah.
I'm saying,
But you know what? There
um,
were some people who did it so well. Like I have a friend who owned a small hospital up north. And so she said, okay, we can't let clients in the building, but we can still talk to them. So she bought two cheap $99 iPads, put Zoom on it, would send one out to the car and have conversations with clients in the exam room, set it up on a tray and just have a conversation with the client without bringing them in the building. But
oh
they
yeah,
felt like they were there, right? They were seeing what was happening. I mean,
I went outside and talked
be
to clients.
creative. We can be
I I
creative.
I put chairs outside that were 6 feet apart,
Yeah,
and I would have them get out of the car, and we'd go sit in the chairs, and we would discuss everything.
yeah.
I still made sure I had time to talk to those clients.
Hmm.
Now, if it was a young, healthy puppy, I would just go out to the car. Hey, everything looks great. We'll see you next time. Okay,
Hmm.
see ya.
Yeah,
Um, and there were clients that were scared shitless about COVID.
yeah,
And when I would have to talk to them through a closed window.
yeah, yeah,
But
yeah.
whatever.
All right, we'll figure
You
it
do what
out.
you do. You do
Yeah,
you, I'll
let's
do
figure it
me.
out.
Yeah,
Yeah,
exactly.
yeah.
Um, but exactly. So, and then the other thing that really, really, really is killing this profession and a huge disruption we need is better mentoring. And I was talking to Danny about this a couple days ago at Ready Vet Go, which is like, I know you're teaching the skills, but you also need to teach them. If you do not feel comfortable in clinic because it isn't what you think it should be, you do not have to work in a veterinary clinic to be a veterinarian. There are other options. And the problem is that these people they're not given those up. So they're either so the ones that don't understand that are staying in and being miserable,
Hmm. And they're making other people miserable around them,
right?
right?
Leaving altogether, like I'm
Hmm.
done,
Yeah,
or you know, and they hurt themselves. And
yeah,
obviously, when we discuss that whole, I mean, trying to get a suicide study through the IRB approval process at a university, next to impossible. So
mm-hmm.
I'm never, ever going to study that.
Mm-hmm.
But I can write a conceptual paper on what I think is happening,
Mm-hmm.
and maybe someone else can study that, and I
Then
hope they
pick it up
do,
and move on. Yeah,
because
yeah.
I mean that is so deep and dark.
Mm-hmm.
And I'm very happy to say that at least the eight and everyone's like, well, you only talk to 18 veterinarians. Yeah, you know what? When you talk to 18 veterinarians for about an hour and a half, with the same list of questions and you keep hearing the same answers over and over and over
Yeah.
again, let me
Yeah.
tell you
You got
what,
a theme. You got a
you're
trend.
on to something.
You
You
got
know,
there. Well, and the
when
other
you
part of it too is you also did that little AI thing in Reddit, and you looked at, the vast number
always,
was about the clients, it's about dealing with like clients.
yeah,
And of
yep,
course, on my side of the coin here, I've been training communication and client service for a very long time. And I think sometimes that, and I get, and Peter, God bless him, he's as disruptive as I am, but sometimes he'd let me do this talk at AVMA a couple of years ago. And basic premise was sometimes we set them on fire. It's because we haven't been trained appropriately to have conversations or to present a no that sounds like a yes to a client. And then they are immediately go into that limbic brain attack, defend, fearful mode. And then we, are go into our fearful mode, and pretty
right.
soon the whole situation is blown to hell, and we can't get it back down to normal. So going back to how do we
Emotional intelligence.
train? How do
That is
we
emotion.
train? It
That,
is because emotion. I just had a podcast last week with Dr. Rick Lacuter, who was great. I mean, he got out of vet school, went to work with James Harriet. Like, oh my God. Um, but we were talking about emotional intelligence, and I feel like sometimes people don't really understand what it is. It's kind of like, oh, you're not emotionally intelligent enough to handle a situation. That's not it. When you're emotionally intelligent, you can not only handle your own emotions, that you are good at helping other people balance their emotions and get to a good emotional plane. And it's a trainable skill. We can learn to do that because we have to recognize it in ourselves, what our limbic brain is telling us that the fear is setting in. And you laughed, we talked about fear free, but it is a really good tutorial for human fearful anxiety. I mean, that's all those things are happening in the practice when people come in, even for a new puppy visit, because this is a really new territory to people. And people have so little medical knowledge that even the basic stuff we talk about is often over their head.
right.
And we've got to realize we got to take it down in order to make people feel comfortable, because when they feel uncomfortable, then they start to attack because we have made them feel uncomfortable. So, it does put a burden on us, but that burden is training.
Right.
That's the burden. It's not like you have to do it all and take it all. You have to be trained to manage it and manage yourself. Yeah.
Yeah. Well, yeah. Thank you for bringing it. Yeah. My newsletter, Veterinary Intelligence. So that all came, that brainchild came up during my qualitative four class where they were talking about how, one of my professors was like, well, I was able to take themes and give them percentages as far as how many times I saw it and heard it. And I'm like, man, I bet you Python can do that. And so what I do is I use Python to scrape Reddit for certain topics.
Hmm.
And because Reddit is a wonderful, wonderful untapped resource, which is basically people truly are writing how they truly feel
Hmm.
because everyone becomes a keyboard warrior at that
Hmm.
point, right?
Yeah.
And it is so amazing to me to be able to compare what you get off Reddit to what's been done in empirical research and see if they're right or wrong.
Hmm.
And I'm going to just put a plug in for a DBA. Like everyone's like, why didn't you get a PhD? And I'm like, well, listen, PhDs, you come up with theory. You have zero idea whether or not it's going to work or not. You just come up with a theory. Where with a doctorate in business administration, you are a scholar practitioner. There's a minimum requirement of years you've worked in an industry before you can apply.
Hmm.
So you have seen the problems, you have worked the problems, you've heard about the problems, you've read about the problems. Your job is to come up with solutions to problems. And that's the disruptor.
Hmm.
And that's what I love. And I mean, and I'm not putting a plug either into for Pepperdine, but my Pepperdine experience has been just absolutely incredible. You know, talking to other DBAs that are in the veterinary profession, they are blown away that Pepperdine has allowed me to do this research. They're amazed that they're like because a lot of these DBAs they want to know, how is AI going to change healthcare?
Hmm.
Like how is working from home going to change the working industry? Like those types of things where
Right.
but I was able to prove to them. I'm like, look, there's a $2 to $4 billion loss a year in our profession
Hmm.
because of burnout.
Yeah.
These are all the papers that have been written about burnout. And
Yeah.
then it became compassion fatigue.
Yeah.
Yet the problem isn't getting better. It's going worse because now we're talking about suicide.
Yeah.
So, so
One thing that you mentioned I want to go back to, Gersh, is you talked about that people, can't see any other way out. And that again goes back to very much those levels and constantly the fatigue of thought that happens when you're constantly bombarded by this hormone that says you're in a fear for your life. Is that it's why women don't leave men who abuse them. They can't see
right,
their
they
way
have the
out.
same four choices themselves,
Right.
right?
Can't see the way out. Right.
They have the same
Yeah.
four choices. And
Hmm.
you know, I have three amazing daughters, and I always taught them their self-worth and never to count on anybody, trying to circumvent that exact situation.
Hmm. Yeah.
But I mean, toxic relationships are left and right. And
Hmm.
that's a whole different podcast we could do.
Yeah. True.
No, there's no difference, and you're absolutely correct. No difference between a toxic relationship with a profession versus toxic relationship with a marriage or a relationship.
Hmm.
Because how many young girls do you know when they're 5 or 6 start dreaming of their wedding,
Oh, yeah. Yeah.
right?
Yeah. My
And
best friend had hers planned out to the nth degree in the name of all her children. I went, girl, I got better things to do than that. Yeah. It's not me.
yeah. Well, I told my one daughter to go elope. I told my other daughter to go to the justice of the peace. I'm trying to avoid those
I
price
told my
tags.
goddaughter, I said, take the money and go on the best trip of your
Yeah.
life,
That's what I would tell my third
Yeah.
one. Hey, I'll
Yeah.
pay for you to go to Europe for 3 months.
Yeah.
Go.
Go. Go. All
But
you're doing is feeding a bunch of people who want to, come in for a free meal. Go,
yeah.
yeah.
Yeah, bottom line is we need to make this profession sustainable because the numbers are not there,
Hmm.
right? We're losing 4,000, we graduate 4,000 veterinarians a year. We have 7,000 open jobs. And of those 4,000, how many of them are gone within 5 years?
Yeah. Well,
And
and it is kind of sad that we ask people to choose their life's work when they're teenagers. I was one of those kids at 5 years old. I'm going to be a vet. I'm going to be a vet. Going to be a vet. Apply to one school, NC State. That was it. My mother's like, "What if you don't get in?" I went, "I'm getting in." So sure, yeah, I did. But then I didn't want to be a vet anymore. I don't know why I had this epiphany. I just said, I'm done. I don't want to do it anymore. But getting into the management of it allowed me to live in the science and in the profession
right.
and do the people part of it that I love so much. So if you're a veterinarian and you're getting tired of the work, go manage a veterinary hospital, go run a veterinary hospital. Look, I mean, look at the degree as possible. I think that smart people can do anything they want to. And it's so much of diagnostic skill has to do with running a business. You are just figuring out a problem and how to solve it no
Mhm.
matter what. So it translates into a lot of different things, any kind of business, I would say. Yeah.
Yeah. And that's what I'm hoping this research, I hope it's going to open some eyes, and I hope it's going to, you know, it maybe change the way we're looking at stuff
Mhm.
because, obviously and don't get me wrong, there's been amazing, amazing research, a lot of amazing research
Mhm.
written, but it's getting us, what is it doing? Are we just ignoring it?
Well, I mean, we
Is
just
it not
talk
the
about
right
it,
stuff?
right? We just talk about it, but talking about isn't fixing it. And
Right.
I find it very frustrating. And, kind of going back to the academic thing, 10 years ago now, I guess, I went to NC State and I went, look, you guys, you have 1,000 students in the pre-vet program here at this college. How many will get into veterinary school? And the answer is 100. And only 80 of them can go here, but 100. I
Right.
said, what happens to the other 900 kids that want to get into this profession? They go, well, we don't know. Maybe they'll apply next year. Maybe they'll get it. Maybe they'll do something different. I know, well, why couldn't we teach them to manage hospitals? We desperately need good leaders in our hospitals. A great portion of what our challenges are in this profession is We have people who are leading hospitals, who are managing hospitals, who are not leading hospitals. And there's two
Correct.
different things to that. So why couldn't we do that? Because here I know we have all the classes because I took them when I was here, and we don't have to charge any more money, and we could do it all in undergraduate, and it wouldn't cost them any more in student loan debt. And then when they got into vet school, they would understand accounting and marketing and operations and, the HR part of the business part of vet med, and they would become better associates and potential business owners out there in the world. And whoever they work for is they're going to be a blessing to whoever they work for, or they can own their own business, and they were prepared in undergrad. 10 years we worked on it and still have not managed to get it there. So,
Well, I mean, there's a lot of things you need to change when it comes to acceptance. We already talked about.
mhm,
How about during the education? Like, I understand you want people to take poultry and virology and, immunology,
mhm,
but I mean, they go so in depth in medical school where if you're just going to get into practice, do you really use a whole semester of virology?
mhm,
No. Do
mhm.
you use a whole semester of immunology? There's areas where they could say, you know what? We need to throw an emotional intelligence piece in here.
Yeah,
We need to teach the soft skills as much as we're teaching the technical skills. Um, and I understand it. The OGs look at it as a rite of passage to become a veterinarian, but hey, got something for you, OGs. This profession is not going to be around,
that's
you
right.
know, 20
That's
years
right.
from now with the numbers we have. It's a numbers
Yeah.
game, and opening up more veterinary schools is not the answer.
No,
Who's going to teach them? That's the
right.
first basic question I have.
Yeah, where are
Who's
the
going to teach?
professors and how are you going to teach them? And then will they have jobs? Because sometimes the market, as you know, you said your dad was an economist. This is my fifth recession, right, in veterinary
Mhm.
medicine. And, in 2008, the AVMA was going like, we have too many veterinarians. We should not have any more veterinarians. They don't have jobs. And so those kids getting out of school couldn't find work. And now, we have a veterinary shortage, but is it real or is it perceived? Because we have a lot of veterinarians, they just don't stay. They don't work as many hours as the OG guys, right? Because they were 60-hour work weeks minimum usually. And
Mhm.
now they're 30 to 32 is considered full time for a veterinarian graduating today. So
Mhm.
there's a lot of different variables that I think have happened over the years that kind of changed what the work week even looks like in veterinary medicine, as opposed to what it did, the James Harriet, the James Harriet, um, which wasn't really true anyway. You know,
Well, he was very clinically depressed. I found this out from a
yeah,
podcast guest I
yeah,
had.
he
And
was, and what,
I asked that
yeah,
guest, I was like, would James Harriet survive in today's veterinary
yeah.
medicine world? And she said no.
Yeah. Again, the other thing too is it's harder now. And I think the emotional attachment that humans have now with their animals has ramped up the emotional challenge of the work. Having looked at this for a very long time, people would come in, they had a hit by a car and it was going to cost more than $50. They go, and just put him to sleep. Or I've had people look at me and say, I'll take him home and shoot him. And I'd said, that's,
I've been
your
there. I
prerogative.
I did my undergrad in North Carolina. I know
Yeah,
exactly what you're talking
you
about.
know what I'm talking about.
He's
And
not a good
then
hunter. He's not a good hunter. Got to
yep,
put him down.
I'm gonna put him down. That's right. That's right.
Mhm.
Keeps getting hurt all every time we put him in the field. We got to put him down. So that was that there was a practicality to, I guess, pet owners, and the animals lived outside. They were tied to the porch and they didn't come in the house until Novartis created program, and it changed everything.
Oh,
And
with the fleas.
yeah, yeah,
Oh, did it? Oh,
yeah.
did it?
Everything changed. Bob Jones and I have had this conversation is that was a completely profession changing product because it took animals from outside to inside and
Yeah.
let
Was that
people started
93?
about 93 started living with them intimately
Yeah.
as opposed to because now they didn't have fleas and we weren't fighting it in our house. So changed everything about how we think about animals
Oh my
at that point
gosh.
in time. Hmm.
And then they came out with the mixture of program with interceptor.
Yeah.
What
Oh
a
yeah.
game changer.
Yeah.
What a game changer.
My first order of that, because we did the clinical trials. We were in Greensboro, North Carolina, did the clinical trials for Novartis on program. And my first order was $35,000 worth of that product. Now in 19, roughly 92, 93,
Right. That's a
and
lot.
they ran out of product.
Well,
They could not
well,
get it.
yeah. I mean, I remember the two doctors I worked with back in the day when they did it. Novartis flew them to the Virgin Islands for a
Uh-huh.
vacation. You know, when they could give rewards.
Uh-huh.
For- Yeah.
Yeah.
I mean, it was poof,
Yeah.
it was a game changer. You're so
Yeah.
right on with that.
Yeah. That is the tipping point right
Yeah.
there about how animals, the place in the home changed. They went from the backyard to the porch, from the porch to the living room, from the living room to the bedroom, and now they have their own bedroom, their own baby stroller, their own wardrobe.
And their own seat on their plane.
Oh, yes, their own seat on the plane. And what did I see the other day? Their own magazine called Dogue, which was like Vogue. It was a takeoff of Vogue,
Yeah.
their own fashion magazine for dogs. So, it does make it harder because there is it's such an emotional attachment
Yes.
to animals as composed, although they're still considered property. So it puts us in a very challenging position
Not for long.
legally. Yeah. No, no. I think
That's
it's
going to
coming.
change.
I think it's coming. And, there's going to be veterinarians out there that embrace it and go, yes, we always knew they were sentient beings. We always knew they should have rights. And then the other ones go, well, now we got to deal with, lawyers and all the stuff. So there's a,
We already do. We already
yeah,
do deal with lawyers. But I mean, the thing is, when they're no longer property,
yeah,
that's where pain and suffering comes in
yeah, exactly.
for
And
the
it
pet
is, it
and
is
for the
coming.
owner.
It is
It
coming.
is.
It is
Woof.
coming. So it behooves us to do the things that we're talking about and gain that emotional intelligence and really build that raving fan base of clients who believe us, trust us, listen to us, advocate for us, go out into the world and sell our practice to their friends and family because we have, created this great human to human and pet bond with them, and working like that. It's just the best. You probably had your practices, I'm sure, were like that. It is the best.
I miss it.
Hmm.
I truly, and that's the one thing working on the weekends at my band fields. At least I get that sitting down and educating clients and getting to learn about clients and learning
Hmm.
about their kids and what sports they play. And like I these veterinary these technician RVTs and these veterinary assistants and CRMs, even the managers, they don't get it. They don't understand, like, holy cow, like, you're able to get him to do this. We've been telling him for 5 years to do this.
You've been telling him, right? Just telling him
Mhm.
doesn't do
Right.
it. You've got to
No.
you
Yep.
got to share and collaborate. This is the idea, is that we are not the hero. Like I said, we are not the hero of the story. We are the guide. We are the wise counselor.
Show
And
that you
we are,
care,
yeah.
show compassion,
Hmm.
show empathy. That's
Hmm.
all you got to
It's
do.
all you gotta do. It's all you
Yep.
gotta do. Yeah, learn to read the body language. Learn to, listen to yourself and make sure that you're, oh my gosh. I laugh because there was a older veterinarian and he had the best line ever. And I was listening to him one day and this lady came into his practice and I was doing some shadowing his blocked cat. And he said, well, your cat's blocked and, we're going to have to do something. And he said, well, she said, well, I don't know. And he said, look, have you ever had a clogged toilet in your house? And she said, yeah. He said, same principle. And she went, oh, I get it. Right. Because I've heard young veterinarians, they were explaining about stone and uroliths and ureters and
Uh,
the clients are like, phew, it's it's over their head. This guy
yeah.
said clogged toilet. The light bulb went off. He went, I get it. I understand what we got to do. Let's do it. And there we go. So it's just learning how to simplify, for the people who are in front of you who are not veterinarians, who,
Correct.
yeah, I mean, they've Dr. Googled, but, even you're talking about
Chat.
AI.
Chat GPT.
Chat GPT, but the problem is you got to know enough to put a prompt in that
Yeah.
gives you a response that's not completely off the wall. I was looking at something the other day, and it was from Mount Sinai on the human side, and was talking about Chat GPT, and that and it has like ChatGPT Health, right? They have the health version of it now. And so clients were going on there, patients were going on there and putting their symptoms in, and it was 63% of the people it sent to their GP or their internal medicine doctor didn't really need to go. There was stuff that was fine. They were just uninformed, but it missed more than 30% of the people who needed to go to the ER.
Well,
And yeah.
it's funny you mentioned that because one of the companies that I'm an advisor for right now, they're
Hmm.
called Pearl. I don't know if you've heard of them, but um, we're trying to change that name because I told them Pearl in the veterinary context is kind of a negative connotation. But what they do is they own the website Ask Anything. Um, and that's where you can get in and ask law questions, health
Hmm.
questions, and all that. So long story short is clients can get on and ask questions about their pet. Hey, my dog, my 20-pound dog just ate a 10 milligram gummy, for
Hmm.
example. And then the chat will ask some more questions and then it will spit out something. But even though Pearl's an AI company, they don't trust AI. They pay veterinarians to go on and confirm what was spit out is correct.
Hmm.
So that is there, that is possible.
Hmm.
And they're actually white labeling it so
Hmm.
clinics can put it on their
Hmm.
home webpage.
Yeah. Yeah, you need the
And
human, right? You
yeah,
need the
you do,
human
you
in the
do.
loop.
But the problem is in veterinary medicine, we are so slow to evolve and we're so scared of technology. And I was so upset because like how many scribe programs do we truly
Oh my
flipping
God,
need?
there must be 48 on the market. And the next thing now, I was I was inundated at VMX by people who want to do AI receptionist. And I said, okay, what are you going to do if your client calls up and says, I'm
Right.
thinking about putting my dog to sleep? What is your
Right.
AI response to that? And the guy's like, I said,
Well,
because you came from human side.
there
And
is
yeah.
one great company called Missed Calls AI.
Hmm.
So you can use that as your answering service at
Right.
night.
Yeah.
And then it can go into your PIMS, it can create appointments, it can do, but no, and you can have it on during the day
Uh,
because there is a dashboard that it will say, hey, you missed Mrs. Smith. She called
hmm.
about Puffy,
Hmm.
So you go, oh, okay. You missed this. They need a prescription
Hmm.
refill. It can make it easier, but no, clients want to talk to a human
Right.
when possible.
When they call.
Period.
If they just want a simple
Period.
appointment, they would go to your website, push a button, and make their appointment online.
Right.
No big deal. But if they're calling, they are stressed and they want a person. And I feel
To
like
talk
the
them off the
AI,
ledge.
yeah,
To
I
talk
feel
them.
like the AI is good. Like you said, it's like an
Mhm.
educated voicemail, which I think is great. And it would
Right.
save a lot of, can I get an appointment or do I need to refill my prescription or what, are you taking new client? Yeah, all that's great. But the other part of it is, as we've mentioned earlier, we're a profession that likes animals better than humans. And so you have CSRs at the front desk who really don't like to talk on the phone. A whole generation doesn't like to talk on the
Right.
telephone. And so they have AI receptionists answering your overflow calls, supposedly. And now all of a sudden, everybody goes, oh, the AI will get it. I won't answer it. The AI will get it. And
Yeah,
your whole front desk is not answering the phone anymore. So I feel like there is some caveats to the benefit of
well,
AI stuff that we have in practice. And I
well,
use it all
if
the
your
time. I think it's
practice is
great.
small enough and you can't have a call center, maybe
Yeah.
that makes a little bit more
Yeah.
sense. But still, it's like it for me, it's more of the overnight calls because
Hmm. I think that's the place for it. Absolutely.
clinics
Agree with you.
clinics don't know how much money they lose overnight.
No. And people are calling after work and they just turn it over to voicemail and people get frustrated and hang up and they,
Or it goes right to the emergency clinic,
yeah.
right?
Yeah.
They just forward the phone to the emergency clinic.
Right, right. And it's
And
not, I mean, I've liked the like Pet Guardian and some of those services that do really good triage and you're talking to a human that goes, yeah, you do need to go to the emergency clinic.
but you
Or
pay a
no,
lot for that.
yeah, it can wait tomorrow. Yeah, you do. I mean, you do.
Mm. Yeah.
But you're getting, veterinarians and licensed technicians answering your calls too. So, and there's other ones like Pet Triage that do kind of a similar thing. But I think there's opportunity out there for us to serve people after hours, and we have tools that can do that. Um, well, we have been talking a lot, and we're going to run out of time, and I'm
Yeah.
Yeah, I feel like my audience is like, wait, don't go yet. So I would love this question. If you could rewrite one rule in veterinary medicine, what would it be and why?
That's kind of a loaded question to me, right? No. I, just one rule.
Just one rule.
I would this goes out to all the pre-veterinary students. You truly want to be in this profession, the one rule is you need to go work in a veterinary setting and be involved. Not shadowing for 80 hours, not shadow or volunteering at the shelter. Go get a job at a veterinary clinic. Make sure this is for you because it could be a huge emotional roller coaster, a $500,000 in debt mistake if this isn't for you.
Hmm.
And I think that's the one rule I would love to implement.
Yeah, I think it should be a requirement for entry because you have got to know what it's really like. And more than one practice
Oof,
too,
yeah,
ideally. Go in more than one
yeah,
practice.
correct.
Um,
And so
mhm.
that's the one rule I would change
Yeah.
because I think that if we took care of that rule, then I
Uh-huh.
think a lot of the other things that we talked about for today
Yeah,
probably go away.
they probably would. I think they probably would. I think you're right. Gerson, this has been great. I really can't wait to read your paper when it all comes out and you get
Oof.
all this data together and and we could solve the problems of the world. I think there's a lot of, like you said, there's a lot of talk and we are bringing these things out into the open and we're talking about them, but we're not
We need
fixing
to
it.
act. We need to
Yeah.
implement. We need
Yeah.
to execute.
A lot of
That's what we
chatter.
don't do as a profession.
Yeah, a lot of chatter, but no fixing it. And I feel like action is what is required here. And so thank you for taking the bull by the horns and just, say, I'm going to find the data. I'm going to find the thing that we can work on, or actually the two or three things that we can work on. And, it's not going to happen overnight. And it's
No,
certainly, but at least if you have a target, you know where to aim. It's sort of like having a mission or a practice that has no mission, right?
you're right.
Everybody's just
Yeah.
off doing their own thing and running around and going, oh, it's this, it's this, it's this. And nobody really knows what their targeting is. And so I feel like, by pinpointing a lot of the work that you're doing, we actually can get ahead of it rather than try. What we're doing right now is it's kind of like reading your
We're
P&L.
band-aids. We're
Yeah, I
putting
mean,
band-aids
tax
on.
season, right? By the time you read your P&L for the year and you got to pay your taxes, you don't even know if you lost money in February
Right.
and because it's too late, right? It's too late to fix it. So we need to get early into the problem and fix it early in the game. So appreciate that.
Always up for a good disruption.
Yeah, I love it. All right. Well, thank you again for being on the show. We will put all your information in the show notes so people can follow you on LinkedIn and read all your good stuff and the dissertation when it comes out and sharing your data points with us. And then whatever the action comes in after that, how we can disrupt that too. And you and my friend Peter Weinstein, if you need some help, I'm up for it. I'm up for it.
Yeah, yeah. Well, that's the thing. I'm trying to surround myself with people who are huge cheerleaders for this profession. But the problem is our voices are quiet.
Yes.
Um, and the people that are not cheerleaders for this profession, their voices are on megaphones.
Yeah,
And we
you're
need to
exactly right.
change that narrative.
We need to flip the script. We absolutely do. And the other thing too is that humans are suggestible, right? And so the more it's kind of like I used to tell people, if you get up in the morning and you stump your toe on the nightstand and you go, son of a gun, the day's going to be like this. Everything's going to go wrong. I started out this way. But if you go, oh man, I got it over with. Now the worst thing that could happen to me today has happened, and the rest of the day is going to be a cakewalk. Then we walk through it with a different attitude. So I feel like we need to have the people who love what they do talk a little bit more about how great it is
Yep.
and amplify those voices. So
Absolutely.
yeah,
Absolutely. And we start by doing this.
yeah,
And
we
I
do.
can't thank you enough for having me on today.
Well, I appreciate your time and all the work that you're doing. And thank you to the audience for joining us today on this episode of The Ben. Again, my name is Debbie Boone, and I appreciate your time as well. Thank you for joining us today.
See you soon.